Good morning, Peter Goertz. I'm a psychiatrist. What to look for in internship and psychiatric residency? I'll talk briefly about myself. I did my internship at LSU in New Orleans, and it was a so-called transitional year, so a rotating internship with internal medicine, pediatrics, surgery, and OBGYN. And I spent almost 3 months in emergency rooms, so medical emergency room, surgical emergency room, pediatric emergency room. And it was mostly a charity hospital in New Orleans, which is now closed. And that hospital was mostly run by residents. I mean, there were attending physicians there, but the vast majority of doctors in that hospital were residents, and there was a lot of independence. We did rotate in other hospitals also, and bottom line, we got a lot of hands-on experience. Charity hospital was like a throwback to a different time. There were rows of beds with patients, and so if something happened with one patient, everyone would see it. I remember once a patient started squirting blood out of his neck while I was rounding. It was not even my patient. I helped as best I could until the patient could be taken to the OR, but all the other patients on the ward would be seeing things like that. So it was an older setup in that hospital. And I spent most of that year in the hospital. There was not a whole lot of time for recreation. But on the other hand, I did learn more that year than probably in any other year in my life about medical issues. And what I'd been looking for is a place with a lot of where I could get a lot of hands-on experience, and that's what I got. And analogously, in residency, I was looking for the same thing, another place with a lot of hands-on experience. And I did my residency in psychiatry at NYU in New York City, which was mostly at Bellevue, but we rotated at quite a few other hospitals like the VA, NYU Hospital, which was called Tisch Hospital, Manhattan State Hospital also. And we did a 2-month rotation in neurology on a ward. I myself did a 2-month elective in neurology in clinics. And again, I got a lot of hands-on experience. So what are you looking for with your residency? Nowadays, most people do internship and residency in one package. So what are you looking for? Do you want a bigger city, a smaller city, a bigger program, a smaller program? The NYU residency program was a big program with about 20 residents per class or per year. And it worked out well though, because we had a lot of sites. So there were a lot of rotations. So there was plenty to do for 20 residents. And another question is, do you want a warm climate, a cool climate? What options for recreation do you want in the city where you do your residency? Is it okay if the city is a very expensive place to live? Like in New York City, for instance, it would be hard to afford a car probably if you're a resident. And what patient populations do you enjoy working with most? Do you prefer poor populations? Do you prefer more wealthy populations? Do you want to do research? Do you want to be able to moonlight? When I was a resident at NYU, we were able to moonlight in the emergency room at Bellevue Hospital, and that was a good experience. We got a lot of experience and also made good money there. And as far as attending supervision, do you want it to be loose or less loose? So do you want people to basically be looking over your shoulder a lot or not? It depends. Each person is different. I enjoyed at NYU is quite loose in general, the attending supervision, but you definitely got supervision if you wanted it. You could always ask for it. And that worked out well for me. You want to make sure you get enough experience in psychopharmacology, also enough experience in individual psychotherapy, in group psychotherapy. And also, you want to make sure, because you may never get more experience in child psychiatry after residency if you don't specialize in child psychiatry, you want to make sure you go to a residency program that offers good experience in child psychiatry At Bellevue, there was an excellently run child psychiatry ward, so that was a great place to learn. And also, if possible, you want to get experience in a state hospital. And luckily, I was able to get that experience. Nowadays, it's probably a lot more difficult to get experience in a state psychiatric hospital. There are only few state psychiatric hospitals left in the country, or a lot less than previously. You want to make sure, if at all possible, you get experience with ECT, performing ECT, and also as far as didactics, so classroom learning during residency, you want to do your best to make sure there are strong didactics in your program so that you're well prepared for the board exam. What electives are available is of interest when you look at a program. What is the on-call schedule like? And until what year of residency will you be on call? And are there specific psychiatrists, specific neurologists, specific researchers in a given program that you want to work with? Do you want to work with medical students? Do you want to teach students? So you want to make sure, if that is the case, you want to make sure you're in a program where there are medical students that work with you. Is there going to be enough time to read, to study during residency? So during your interview, you want to ask those questions, and also especially ask questions of residents in the program that are currently in the program when you interview. Thank you.